Our presentation was over fetal alcohol syndrome. Fetal alcohol syndrome, or FAS, is a clinical condition that occurs from alcoholic exposure and ingestion from the mother to an infant during pregnancy. Those diagnosed with this condition portray the following features of facial dysmorphia, growth retardation, disabilities of neurobehavior, and a lack of central nervous system function. As any dose of alcohol exposure to a fetus is considered teratogenic, it causes malformation during growth as a result from an excessive amount of cell death. Though it is characterized by physical abnormalities and mental retardation, the degree of its severity is determined by the presence of postnatal support. The learning objectives for this presentation over fetal alcohol syndrome are to really understand what the condition is. By the end of this presentation, the audience must be able to define the qualifications that are needed to be diagnosed with fetal alcohol syndrome. They must also be able to understand how this clinical condition affects the population experiencing it. This means understanding the different characteristics that the clinical population may have in cognitive behavior and physical attributes, and relating that to the conditions of their prenatal development. The audience should be able to clarify how the condition occurs and the differences in motor skill development that those undergoing fetal alcohol syndrome may go through compared to the typical developmental pathway. Lastly, the audience must be able to refer to the different treatments used to optimize motor development and cognition.
The consumption of alcohol during pregnancy is the only cause of fetal alcohol syndrome. With 4 different variations of the syndrome across the spectrum, the severity can vary widely while the symptoms are caused by exposure of alcohol to the fetus. Fetal alcohol syndrome has a global rate of 9.6% and a 1 to 5% rate in the US alone. It is more prevalent in European countries and low-income communities with limited resources and access to education.
So we can first discuss the physical features of fetal alcohol syndrome. Physical defects may include pretty distinctive facial features, which includes microcephaly or an abnormally small head, small palpable fissures, or just like the small width of your eyes, abnormally small, a very thin upper lip, short upturned nose, smooth philtrum, or like a smooth skin between the nose and upper lip, epicanthal folds, which are nasal skin creases kind of between your eye and your nose, and micrognathia, which is a small lower jaw. But the more prevalent features are highlighted in blue on the graphic. And other problems associated may include deformities of joints, limbs, and fingers, retarded physical growth before and after birth, vision difficulties or hearing problems, and maybe heart defects and problems with kidneys and bones have been found as well. Social, cognitive, and language problems are a pretty central part of fetal alcohol syndrome and diagnosing it. So we'll just start with social and language problems. Problems in functioning, coping, and interacting with others may include difficulty in school, trouble getting along with others, poor social skills, trouble adapting to change or switching from one task to another, problems with behavior and impulse control, poor concept of time, problems staying on task, and finally, difficulty planning or working toward a goal. And in one study that was assessing socio-emotional function, it was performed with the help of VABS, or the Vineland Adaptive Behavior Scale, which is a measure of social skills and emotional maturity. This study was performed by Olson et al. In 1992, and they discovered that the most substantial social deficits were number one, assessing interpersonal skills, and number two, the ability to conform to social conventions. And other problems that were highlighted in this study were included like failure to consider consequences to one's own actions. Number two, lack of responsiveness to social cues, and poor interpersonal relationships. in the interpersonal skills section of the VABS, subjects with FAS actually scored about 20 points lower than average based on an IQ subdivision. Cognitive problems are the other half of behavioral problems for fetal alcohol syndrome. And various studies reported deficits in sustained attention, focused attention, planning, and learning and memory, all of which were related to alcohol-related neurodevelopmental disorders. And other problems that were pretty prevalent include poor coordination or balance, difficulty with reasoning and problem solving, poor judgment skills, jitteriness or hyperactivity, and rapidly changing moods. Another study performed by Olson et al. Found that poor performance related to prenatal alcohol exposure in serial reaction time tasks, which included remembering patterns of computer keystrokes, as well as timed reading comprehension tests. And this was indicative of problems with sustained attention. And then Kerms et al., another researcher, used the California Verbal Learning Test, or CVLT, and he showed that non-retarded adults with FAS had trouble memorizing new information, as well as retaining and retrieving what they had previously learned. This demonstrated problems with learning and working in declarative memory, especially when compared to normal non-retarded adults without FAS. Other studies would demonstrate that procedural memory is apparently not affected. So it's mostly just recalling, active recall of information with working declarative memory.
Children with fetal alcohol syndrome can have difficulties with development in gross and fine motor skills that can be seen in this set of symptoms, such that deficits in motor skills are likely to be seen in a lack of physical coordination, stability and balance, body awareness, and hand-eye coordination. Since children with fetal alcohol syndrome are mainly reliant on somatosensory input with an inability to compensate using available visual and vestibular information, they can present a significant anterior-posterior body sway. Additionally, fine motor skill deficits present symptoms of weak hand strength, issues with grasping and manipulating objects, and bilateral hand use. These difficulties may cause children to seem clumsy, careless, and physically aggressive. Two limitations that children with fetal alcohol syndrome present are changes in brain structure that reduce reaction time and visual spatial abilities needed in motor development. Reaction time is used as an indicator of an individual's cognitive processing speed and can be divided into premotor and motor components that establish if delays are due to central processing of stimulus information or peripheral motor unit recruitment. Additionally, the study assigned their subjects with two tasks to show simple reaction time and choice reaction time, in which children exposed to alcohol performed slower in choice reaction time compared to the control group. Visual, spatial processing, and memory deficits are common in children who have had heavy prenatal alcohol exposure. Some deficits were attributed to difficulty in shifting attention through reductions in the cerebellar vermis, basal ganglia, and frontal lobes. Similar to the symptoms, characteristics of motor behavior in children with fetal alcohol syndrome include delayed development in motor skills and fine motor dysfunction. This may include tremors, weak grasp, and poor hand-eye coordination. Balance is seen to be particularly affected due to damage to cerebellum, while postural balance was attributed to their reliance on atypical somatosensory input.
Now we can discuss a timeline comparison between fetal alcohol syndrome and normal infant to child development. The fetal development chart on the left shows that most structural defects occur within the first and second trimester with relation to alcohol exposure, and then functional defects in the second and third trimester. And the structural defects are kind of highlighted in purple, and then the functional defects are highlighted in pink. But notice that the nervous system and brain development can be affected in all 3 trimesters, which pretty much explains the behavioral and cognitive deficits of fetal alcohol syndrome individuals. And the developmental timeline comparison on the right, physical features will be most pronounced between 8 months to 8 years when comparing normal and individuals with fetal alcohol syndrome. As for cognitive and social development from infancy to 7 years, learning and working or declarative memory deficits, attention deficits, both sustained and focused, inability to understand consequences to actions, among other cognitive and social delays have been noted. These represent difficulties and or delays in reaching standard cognitive and social levels compared to people without fetal alcohol syndrome. As for balance and coordination problems can be seen in locomotion and hand-eye coordination as early as 18 months to 2 years. And this includes activities maybe like walking and climbing stairs. This can be seen with using walls or rails as support for longer than necessary, and certain types of finger and hand grasps. And you'll notice that balance and coordination is pretty interrelated with the next section, which is gross and fine motor skills. And these motor skills are assessed with VABS, which is again, the Vineland adaptive behavior skill. And they also show difficulty with mastery or delays in development compared to people without fetal alcohol syndrome. This could mean that they reach a standard level at a delayed time, or they require more skeletal muscular strength, which is also a problem with fetal alcohol syndrome.
So as far as treatments go, doctors and researchers are still fairly limited. There have been several clinical trials done testing the effects of antioxidants and other supplements, such as vitamin C and glutamine and folic acid up here. And it was found they were able to negate some of the negative effects associated with FAS, but not completely cure it. Whereas with more recent studies, they have looked at the use of regenerative stem cell treatments in order to actually reverse the effects of FAS. Now, the most effective way to combat FAS remains in prevention in the first place. So don't drink when you're pregnant or trying to become pregnant. It sounds that simple because it really is. And there are also several state and federal programs designed to keep track of the mother's alcoholic consumption both before, during, and after birth. And one of those programs is highlighted here on the next slide. So this trial was conducted in the state of Washington and monitored the effects of the program on foster care kids, which typically see higher prevalences of FAS than the typical population. And once it was implemented over a 5-year period, it showed reduced drinking levels of nearly every form, along with reduced prevalences of FAS itself.
Those with fetal alcohol syndrome find themselves having difficulty learning and having a lesser overall intelligence than others. While characteristics of disability and learning vary in severity with each case, this determines the pathway of their motor skill development throughout childhood and adolescence. Many individuals who experience the effects of fetal alcohol syndrome show motor delays from infancy to adolescence, with their motor skills being underdeveloped in comparison to others of the same age, going through the typical developmental route. The motor delays caused by fetal alcohol syndrome present themselves in the fine motor and gross motor aspects of motor learning. These significant delays are a direct result in correlation to the cognitive delays that they go through. In 2018, there was actually a study consisting of 99 subjects with a mean age of 16 years old, with all of these subjects having fetal alcohol syndrome. Their motor skills and cognitive behavior were observed through a series of tests, with handwriting exercises being one of them. Through these tests, the conductors of the lab noted that the majority of the subjects showed the greatest deficit of development in the fine motor skills. Though gross motor skills were also at a slight deficit, it was the fine motor skill tests that the subjects seemed the most behind in comparison to that expected of their age. The test concluded that 84% of the subjects showed lagging results of fine motor skills, specifically handwriting, to that of an expected age range. And as you can see, This image right here shows a 17-year-old male with fetal alcohol syndrome, and the handwriting looks very jerky, very uh, it looks like it shouldn't be written by like the typical 17-year-old male. And then there's a comparison one where it shows a 17-year-old male where he has no diagnosis, and you can really see the difference in how the handwriting is. Fetal alcohol syndrome is a clinical condition caused by the fetal exposure of alcohol during the prenatal period. It's a serious condition that affects the clinical population's physical growth and development. Severity varies case by case, but those who reflect the major characteristics of fetal alcohol syndrome experience deficits in motor skills development and cognitive behavior. Being exposed to a teratogenic agent during pregnancy, the child may experience physical dysmorphia in the face and limbs. Fetal alcohol syndrome is not a curable condition and can only be treated and cared to manage it, with hope in the future of stem cell research being able to reverse cognitive impairments. The best way to prevent fetal alcohol syndrome is to abstain from alcohol during pregnancy and avoiding the result of a child experiencing the behavioral and motor impairments that come along with the condition. Thank you.